available. And afterwards, Lisa Kanapoko from the Assistant Director of Health and Director of Nursing and Dental Services will be available to talk about what the city is doing. And I do believe there's a press conference tomorrow at 10 at the city as well. So Dr. Asha Shah is the Associate Director of Infectious Diseases at Stanford Hospital. She is a doubly board certified physician in infectious disease and internal medicine. Dr. Shah earned her undergraduate degree from the University of Pennsylvania, her medical degree at Wake Forest University School of Medicine, completed her residency at the Hospital of the University of Pennsylvania, and also completed a fellowship at the Columbia University Medical Center. And I just feel that we are so fortunate in Stanford to have an expert like this in our community, and I welcome her. Thank you.
So can we start by having everyone maybe move up to the front so we have a little bit more of a communal, but 6 feet away, but. How does this work? This way? Okay. So today, basically, we're going to talk about coronavirus, the basics, where it started, when it started, symptoms, treatment, and prevention in the community, what you can do to be prepared, and then kind of some efforts that have been going on at the Stanford Hospital to kind of help support the community through this. So the outbreak actually began in the beginning of January. We actually received emails through our infectious diseases listservers saying that there's this, unknown virus. There's an outbreak of viral pneumonia, and as you can see here, the initial report was 27 people. And most of them were stallholders in a wholesale market in Wuhan. And they were in serious condition, and then, we said that this is like possibly a new infectious disease. So from this 27, January 1st, now you see that there are over 97,000 cases seen worldwide. This is actually a great resource we look at each day. This is from the Johns Hopkins website, and this kind of gives you up-to-date information on which countries are affected, how many cases are confirmed in those countries, and it kind of gives you a total toll of how many cases are present. So this is from as of 5 p.m. this evening. And these are the cases that are seen in the United States. We're seeing cases on both now the West Coast and the East Coast. As you know, the one closest to us is from New Rochelle. To date, there have been no cases reported in Connecticut, nor in Stamford. This is from the CDC website as well, and this is basically looking at the COVID cases that have been seen in the United States. And as you can see here, does this pointer work? Oops. They break it down by which cases are travel-related versus person-to-person, and we're starting to see more person-to-person spread within the United States, and less, so that's travel-related. However, the majority of the cases are still travel-related. So what is coronavirus? So coronavirus is a respiratory virus. It's present in the animal kingdom, so mostly in birds and bats is kind of where it originates. There are other coronaviruses, common coronaviruses out there that we know about. Many of them we see infections from every winter. They cause the common cold. They cause both upper and lower respiratory tract infections. They cause a significant proportion of common colds in adults and children. Other viruses that are related to coronavirus are the SARS virus, which I'm sure you all remember the SARS epidemic in the past, and then also MERS, which is Middle Eastern Respiratory Syndrome. That is in the same family as coronavirus, and that is something that's present abroad. We don't see it in the United States, but it is a virus that is related and that we do see year-round. The other coronaviruses tend to be more seasonal. And now we have COVID-19 as the newest coronavirus. So let's put this in perspective, right? So we've actually been here before. We had the SARS epidemic in 2003. We had the pandemic flu outbreak in 2009. We had Ebola in 2013, and then now we have COVID-19. So just to give you a sense of the influenza numbers, in the U.S., we see about 30 to 50 million cases of influenza per year, and about 300,000 hospitalizations per year, and 30,000 to 60,000 deaths. Okay. In Stanford, we actually, we tally essentially our flu numbers every flu season. And we see about 1,000 cases of flu diagnosed through the Stanford Hospital lab per year. And at the peak of the flu season, we see about 80 to 100 positive flu tests a week. And this is about, on average, 100 to 200 hospitalizations per year. And a generally accepted fatality rate for flu is about 1 case per 1,000, but it's really hard to determine a mortality rate from the flu because it's hard to determine if a person's cause of death is the flu or some other kind of comorbid illness along with the flu. So for COVID-19, the symptoms are very similar to the flu. So it's fever, shortness of breath. Symptoms typically appear 2 to 14 days after exposure to a case. Many cases are mild and probably go undiagnosed. I'd say approximately 80% of people who acquire this disease do not require hospitalization. And there is some thought that there's asymptomatic carriage of this disease, meaning that people may carry the virus but not have symptoms of it, and possibly that can serve as a source of infection. Transmission, the risk is highest when patients are symptomatic. So that's a really important point to remember. And the virus is spread by respiratory droplets. And that's within 6 feet of a person who's sick. It's also spread by contact with secretions, and there's an airborne potential for the virus. For testing, we'll get into more details about this, but testing is usually a nose swab and a throat swab, and these are sent now to the State Department of Health. Connecticut acquired the ability to test for COVID-19 as of Friday, February 28th, so last Friday. And so the tests are sent to the state, and the turnaround time is about 1 day from receipt of the test. Testing, as I'm sure many of you have read in the news, is really widely expanding. We've heard news just this evening that there are some commercial labs that will be starting to offer COVID testing as of this coming Monday. Treatment is supportive care. There are currently no antiviral medications that treat this. There's no vaccine as of yet, but things are, in development. I think that if a vaccine were to be developed, we're probably about 12 to 18 months from that happening. So this is a study that was, this is just some data from a reputable medical journal, and it basically looked at about 70,000 cases of COVID-19 in Wuhan. And this was as of early February. And there are a few things I wanted to point out here. The first is that, how do I Oh, here we go. Okay. So the first is that the age distribution of disease. So under 10 years was about 1% of patients. So this led us to believe that maybe the pediatric population isn't really being affected by this disease. That's one theory. Maybe they have subclinical disease, meaning that they don't really get sick from it, but maybe they carry it and they never really got tested. So that was an interesting point. And as you can see, in terms of spectrum of disease, the second bullet, 81% of cases were classified as mild. So important to know that the majority of patients or people who get this illness don't require, hospitalization, higher level of care. It's kind of like a mild flu-like illness. The case fatality rate has been estimated anywhere from 2 to 3%. It's probably closer to 2%. And what's important to know is that the fatality rate is highest in individuals that are elderly and that have other medical conditions. So this is just showing some comparisons between COVID-19, pandemic flu, which was the H1N1 I had referred to from 2009, SARS, and MERS. So, aside from pandemic flu, these are all other types of coronaviruses. And the point here is not necessarily the numbers, but just to show that the symptoms at the bottom, fever, cough, shortness of breath, are very similar across the board in their presentation. In terms of case fatality, again, COVID-19 is maybe about 2% per estimates. Flu, maybe 0.1% to 2%. SARS was a little bit higher, 20%, and MERS is about 35%, so much more severe disease. So the point here is, again, is that this is acting like a flu-like illness. It's just a new one that we've never seen before. So testing, this is a big question. So the CDC just updated their guidelines as of yesterday. And so they kind of put forth some guidelines to help clinicians decide who needs to be tested and who should not. So the first criteria is that a patient needs to have signs and symptoms of the infection. So this would be fever and an acute respiratory illness, cough, shortness of breath, difficulty breathing. But fever is a really important factor in this from my conversations over the past few days with the state and the state lab. Also, close contact with a patient who has COVID-19 within the past 14 days. And so this is becoming more and more relevant to us here in Stanford, because as you know, one of the patients, that have been diagnosed with COVID-19 is from New Rochelle. So, it's contact with someone that has had it is also puts you in the category of potential risk. And then they also say a history of travel from certain geographic regions with ongoing sustained transmission within 14 days of symptom onset. As of now, those areas are China, Japan, South Korea, Italy, Iran, and Hong Kong. And the CDC provides this information and updates it as needed. So this is now currently where testing is available in the United States. So as you can see, testing has rapidly expanded. And the majority of states do have testing available through the departments of health, including Connecticut. So how do you protect yourself? So this is probably one of the most important things to learn and to remember. So you want to avoid close contact with people who are sick. And this is not news, right? This is what we should be doing during the flu season anyways. There's this idea of social distancing, which we're not doing right now. But, in terms of if there's a large group of people who are sick in the community, there's value to staying at home. and kind of staying away from large crowds where you could potentially get sick. Travel restrictions have been in place since the beginning of February. And those are put forth by the CDC. And these are travel restrictions to countries that are considered at risk where widespread transmission is ongoing. As of now, the CDC is recommending that people avoid non-essential travel to China and to Italy. And that information is available on the CDC website. Avoid touching your eyes, your nose, your mouth, right? We touch our face and our noses all day, and I think a lot of it we just don't realize. But hand to mucous membrane contact is probably the easiest way to get sick with this virus, especially if you touch a surface that has the virus on it. Stay home when you're sick. That's key, and that's key for any type of febrile illness. And cover your cough. And we try to teach our kids, to cough into your sleeve and not into your hands, because your hands can then transmit the virus to others. Use a face mask only if you're symptomatic, and we'll go over the face masks shortly, but face masks do not protect you if you are well. Face masks are only for those individuals who have symptoms, and that's to protect other people from getting sick. Hand hygiene can't be stressed enough. Soap and water for at least 20 seconds is the recommendation. You can sing happy birthday, do your ABCs, that's what my kids do. But that usually is enough time to get the germs off of your hands. And it's not actually the soap that's killing the virus, it's the friction and kind of the rubbing that kind of rubs the germs off of your hands, which is why the 20 seconds is so important. Hand sanitizers are also effective, so they can be used in lieu of soap and water. We joke about this, but this is actually true. Fist bumping, elbow tapping instead of shaking hands with people is also a way to prevent the spread of germs. You can clean frequently touched surfaces and objects in your house with regular household detergent and water. Those will kill the virus. And on the CDC website, which we refer to a lot, there's actually a list of household cleaning products that will work against COVID-19. So you may notice, or this may look familiar to you, but these are the same infection prevention measures we use to prevent spread of the flu. Right, so this is nothing that's, groundbreaking, that we're doing something different. This is what we should be doing day to day anyways to prevent getting other respiratory illnesses. So there's a lot of questions about masks and personal protective equipment, which we refer to as PPE. So there's no need for a face mask when you're well, right? We already went over that. Face masks should be used by symptomatic individuals to help prevent the spread of disease, and those that are the surgical string masks, the picture that you see there. Face masks are crucial for healthcare workers and people who are taking care of patients, so first responders in close settings. In the healthcare setting, in the hospital, if we were to be taking care of a COVID-19 patient, we would be using an N95 mask, which is an example of the picture you see here. Those masks are not recommended or not needed for symptomatic patients in the community. And we want to stress this because there's a supply issue in the country. And so we want to really reserve the proper masks for the proper people that need them to take care of these patients. In the hospital, when we take care of a potential COVID-19 case, we also wear gowns, gloves, and eye protection to protect their mucous membranes. So here are the travel restrictions from the CDC website. So this is readily available there. As you can see, China and Iran are on a level 3 travel health notice, and South Korea and Italy are also on the list. And as well as Japan. The CDC recently, as of yesterday, changed their guidelines in terms of who should be self-quarantined when they return from travel. Originally, it was just China, but now Italy and Iran have been added to that list. So if in people who return from those countries and who are well and who don't have symptoms are asked to voluntarily stay at home for 14 days and monitor for symptoms. And that's due to just ongoing widespread distribution in those countries. So it's important to make a plan, right? I think that I would agree with statements, from the CDC and other infectious disease specialists in our community that, it's not a matter of if COVID-19 is going to come to Connecticut or to Stamford, it's just a matter of when. But as you've seen so far, we've been here before. So this is a flu-like illness, and this is something that as a community and as a hospital, we're prepared to handle. So what you can do is make a plan for your household. And this is kind of a way to reduce the spread of disease in the community if we were to have a few cases, in Stamford. So, these are things you can do. And this is from the CDC website. So there's so many good resources on that website for what you can do to prepare. Make a plan on how to take care of those elderly people in your family who may be at more risk of having severe disease from COVID-19. How are we going to take care of, mom? How are we going to take care of grandpa? Know your neighbors, right? Especially if you're asked to stay home for 14 days. If you're put into quarantine, it's good to know who your neighbors are, how you guys can connect on social media, or, through other avenues so that you can communicate while you're at home in case you need something. Choose a room in your house and preferably a bathroom that can be used to separate a sick person in your family from a healthy person is also something that you can start to think about. And be prepared if your child's school or daycare is closed. As you know, that there's been school closings in Westchester County, out of an abundance of caution, and that's a possibility here as well. So it's good to make a plan for childcare. And then plan for potential changes in your workplace. Can you work from home? Can you work different shifts? Stuff like that. All of these things, I'm sure many of your employers are also asking these same questions. So what are we doing at Stamford Hospital? A lot. So we've actually been preparing for this for over 2 months now. When we kind of got word of, that there's something brewing in China, we started to discuss plans and start to get things in place. And this is actually initially slowly, but now has rapidly ramped up kind of over the past couple of weeks. We've been collaborating very closely with the public health departments, the local health departments here, as well as the state health department. We speak with the state epidemiologist at least once or twice a week, and we participate in calls with the state, with other hospitals. And then again, and we follow CDC guidelines, and that's kind of our mantra, and that's where we go for our source of truth. We have come up with algorithms for triaging patients, identifying patients who are appropriate for testing. We've done a tremendous amount of staff education and emergency preparedness with drills in our emergency room. We have worked closely with HR to make sure that we have staff to work if we do get a case, and if people have to stay home on quarantine. We're making plans for that. The personal protective equipment is an important issue, in terms of making sure we have enough supplies to take care of patients in case we do get, a fair number of these patients in the hospital. We communicate both internally and externally, with our physicians, with our staff, and then as well as the community and the public. There is a press conference tomorrow morning. And then we have activated our emergency incident command center, which is like a formal structure for the hospital to kind of work through all of these various items and kind of to put out fires as they come along. So this is basically what we've spoken about. This is just an example, or what you would see if you came onto a Stanford Health site. So to the hospital, to a doctor's office in the community, to radiology to get your, your ultrasound, or to a lab to get your blood work done. So we're trying to tell patients and visitors that if they have a fever, to put on a mask. Again, for the same reason, the mask will prevent others from getting sick. And then there's some questions about travel, if you've been in contact with a case, and if that's the case, then we ask you to let the front desk personnel know, and then they'll kind of know where to take you from there. I do want to make a point about this too, is that we're also telling people that if you have a fever, you should stay home, right? So there's kind of a fine balance between, staying home when you're sick, but coming to a medical center when you need medical care, right? And so that's a challenging thing we've been working on. But, if you have to come and you have a fever, put on a mask. These are travel alerts. We've been doing this for many years in our department. We post this for our emergency room physicians and all of our medical staff so they know what diseases to look out for when patients return from travel. And so as you can see in yellow, we've included the COVID countries. This is an example of what our triage looks like for our physicians, so they know how to send patients to the emergency room if they need further medical care, or to send patients home, if they have no symptoms. And so this is something that we've been working with our community physicians on. And this is an example of a sign that would go on a door for a patient that had COVID-19 in the hospital. So in terms of getting good, solid, up-to-date information. So the Stanford Health website, actually, at the top, you'll see that there is a public health notice, and there's a link there to information that we try to update to keep the community aware of what's going on. And then there's also a link to the CDC website. This is an FAQ sheet that is actually from the CDC website. It's actually a very good resource that we are using in our outpatient sites to give to patients. Again, this is available on the CDC website. So what do you do now? So I think that it's very important to be educated on the facts and know where to get accurate information, because there's a lot of misinformation out there. And what we use against the CDC, the Department of Health website for the city is actually very comprehensive, has a lot of good information for the city, and then the Stanford Health website, as I've shown you. Understand how to protect yourself from respiratory viruses. So not even only COVID-19, but the flu and other kind of your winter respiratory bugs. So hand hygiene, respiratory etiquette, and appropriate mask use, again, only when you're sick. And then think about your household plan. The members of your family that may need more help if we were to get into a situation where you had to stay home and all that stuff, and childcare plans, et cetera. And that's the end of my talk. I don't know, Lisa, if you want to come up and...
Thank you so much, Dr. Shaw, for that presentation. I know we're all wanting more information when it comes to coronavirus. I'm just going to speak. My name is Lisa Konepko. I'm the Assistant Director of Health and Director of Nursing and Dental Services for the City of Stamford, and I'm here just to talk a little bit about the city's preparedness for this virus, and to let you know that we are in close contact with both the CDC and the Connecticut DPH. We have conference calls every week, and so we are in constant communication on both the state and federal level on this continually evolving infection, and that we are working very closely with our local city and health officials, our emergency responders, EMS, our police and fire safety, and we're actively doing an inventory of our PPE just to make sure that the city is prepared in the event that we do see coronavirus here. One thing that we wanted everyone to know is our Stanford CT website, stanfordct.gov, does have information. We have a banner at the top that's got our emergency hotline, so you can call that with information. We also have a fact sheet on there as well, which just has frequently asked questions about coronavirus. We also have a message from our superintendent, Dr. Lucero, and that's specific to schools. We have been meeting with our public, private, and parochial schools, just so that all of our schools have thought about an emergency preparedness plan, that they have a contingency plan in place in the event that a school needs to be closed. We don't anticipate that, but that is something that we are preparing for in the event that that we need to. In addition, we are encouraging residents to get their flu shot because of the high prevalence of flu in Connecticut. And as Dr. Shaw mentioned, hand washing is something we are firmly pushing. We are working to get hand sanitizers in all of our government buildings and having folks wash their hands as they're entering. In addition to that, we are working with our religious leaders, our daycare services, our long-term care facilities, just to make sure that they have an emergency plan as well. And we are working with Stanford Health. We meet with them regularly just to make sure we're on the same page and that we're sharing all of the necessary information. I think that's it, and I think we can move to Q&A. Yes. You want to come up?
Assuming you show symptoms, recommendation is contact our primary care physician and say, I have symptoms, should we go to the hospital? What should we, how do we do? And what happens after we get there?
And can I ask you to repeat the question since we're filming and ask future people to come up to the mics?
Question is, if you develop symptoms, what are the next steps? And that if you do get treatment, what are the steps to getting treatment?
So, so if you get a fever and symptoms, my recommendation would be the first thing to do is to call your physician. The physicians are quickly becoming very well versed in triaging over the phone. Because we're getting a lot of these calls. And basically what they're going to try to figure out from you is what your risk is of having COVID-19. And they're going to base that risk assessment on your travel history, as well as contacts, so like who you've been in contact with. That's the first thing they'll determine on the phone. And then the second part of that is determining whether or not you need to actually come in for medical care versus stay at home and kind of just stay at home. Because again, the majority of people that get this disease can stay at home, about 80%. So your doctor will work with you on the phone about that. Are you having trouble breathing? How long has this been going on? Are you short of breath? If you do meet the criteria, if they recommend that you come in for evaluation, and you do have risk factors for COVID-19, as of now, the recommendation is to go to, the Stanford Emergency Department. And the reason why we're making that recommendation is because the patients can be properly isolated in the emergency department. We can't do the type of isolation that's recommended by the CDC in doctors' offices. And so to kind of minimize exposure to healthcare workers and others around you, that is the current recommendation. But that decision really should come from your physician. And we've been working with the physicians in the community on this for, a while, and so they should know how to guide you in the right way.
Similar questions, pragmatically speaking, if we're supposed to stay home or whatever, is there sort of a tipping point where we should definitely go to the hospital, like if we're going to ride it out, say, okay, 2 or 3 days, or is there a certain point where the fever spikes at certain that if we're just like, I'm going to stay home, but is there something pragmatically where we say, okay, now it's time to go to the hospital?
I think that it's the same for any other respiratory illness. So, if it's, even if this was from the flu and you felt so sick that you can't breathe, and there's kind of like these red flag symptoms, right, that we talk about, that like, oh, something's going on here, I'm not going to get better at home, then you come in. We just ask that, if you're not in touch with a physician in the community and you're coming in, try to come in with a mask so that you are preventing others around you and healthcare workers, first responders from getting sick.
I have a question. Oh, I'm sorry.
The health department has been getting a lot of calls, and people are calling and they're saying that they don't have a fever, they just have a runny nose. And so it's important to know that really for this, it's fever and cough, shortness of breath, trouble breathing. Those who have an underlying medical condition, the elderly, those are a higher risk category.
When you speak about risk factors, and you mentioned elderly, what age range are you talking about?
So, risk factors for COVID-19 is a little bit different than individuals who are at risk for severe disease with COVID-19. So risk factors for COVID-19 are based on exposure. So it's fever and cough, like Lisa mentioned, but then it's exposure, whether it be abroad, in one of these countries where there's widespread community transmission, or to a case, right? And as the cases are getting closer to Stanford, that, that would be someone that's considered at risk for getting the virus. Individuals that are at risk of having severe disease when they have the virus, from the studies that we've looked at and that have been published in medical journals, it's really over the age of 80 where they're seeing the highest fatality rate. And it kind of goes up, 70 to 80 is, a little bit lower, but it's higher than 60 to 70. So it gets a little bit higher the older you get. Not to say that being 80 and above is old, but that's the group that sees the highest mortality rate.
Another question about mortality rate is, what about people who are on immunomodulating or immunosuppressant medications?
Very good question. So that would put an individual in the category of having what we call comorbid illnesses, which means you have other medical problems that put you at risk for having severe disease. And that is irrespective of age.
So if a person had, let's say, more than one comorbid, I can't think of the word, but, situation, what would you recommend if they began to have symptoms?
So it depends on your risk of contracting the virus from like a contact. So if you haven't had contact with anyone that had COVID-19, or if you hadn't been asked by your local Department of Health to self-quarantine because of a potential contact, then, you wouldn't necessarily meet criteria for testing, because again, if you have a fever, it could be from the flu, it could be from, other types of respiratory illnesses, not necessarily COVID-19. So the exposure is becoming more and more important for this particular infection.
One last question about exposure. Let's say that somebody lives in New York City, so they're exposed to many, many people, and they come home and they've been on the subway and somebody's been coughing and sneezing, et cetera, and they were in close contact. I know at this point they wouldn't necessarily be able to get a test, but going forward, if tests become more available, would somebody who is not symptomatic and they were to take a test, would the test show the presence of the virus if they were at an extremely early stage?
testing that's being done it's a PCR test, which is basically, it's a very, very sensitive test, and it actually detects the amount of virus in your system, essentially. There's other types of tests that test for antibodies, and that is like blood testing that will look to see if you've been exposed to COVID-19 in the past. Those tests, the antibody tests have not been developed yet, but they're working on it. They're trying to collect blood samples from patients who are testing positive for COVID-19 to kind of get a sense of what their antibodies look like. So to answer your question, the test that's currently being used is a very sensitive test. So it'll pick up, a very small amount of virus if present. I do want to stress that what the definition of close contact is. So close contact is really being within 6 feet of someone who's symptomatic for more than 10 minutes. So, if you're passing by someone who's coughing in the grocery store, the likelihood of transmission is very low. You have to be around that person for a good amount of time within that close contact. And I know like New York City subways is a perfect example of that when you're in everyone's face. But then that just goes back to the importance of washing your hands, covering your cough, those kind of simple infection prevention strategies to kind of help prevent the spread of disease.
Thank you.
And just to add one other piece, we've been getting calls similar to that is an effective today, per CDC guidelines, a contact of a contact who's been exposed is not considered a risk. So if a student who attended a school where there was a positive case and that person, Jimmy, played with Susie in another town, Susie's not considered a risk at this point because there's 2 degrees of separation. Now that could change, but as of right now, the CDC has said that's not a risk.
Is this virus associated with the season of the year? You hear about spring, and the flu always comes during fall, winter. So is this similar in that way to temperature and?
Hope so. We don't know. So that initial slide about the other viruses in the coronavirus family, the majority of them are seasonal, but one of them is not. MERS is not seasonal. MERS is seen year-round. And so we are hoping that this acts more like the majority of the coronaviruses and that the heat will help us all in many ways, but we don't know yet.
Hi, I have a question about precaution. In addition to taking all the necessary precaution, can taking multivitamin or vitamin C, anything to boost your immune system, help prevent you from getting the virus?
I don't know. So I know a lot of people take vitamin C in the winter to kind of help prevent getting sick. It can't hurt as long as you're not taking too much. I think the same holds true for multivitamins. I don't think it could hurt. It's not really preventative. I think what's more important for prevention is just those simple, wash your hands, stay home if you're sick, cover your cough, and all that stuff. Good sleep, well-rounded diet, all that stuff.
My second question is about traveling. If you are traveling to a country that's not listed on the CDC website, is there any risk, maybe just being in the airplane with someone who might be sick and you not know? Can you get infected just by traveling? Or maybe at the airport during the transition?
So as this virus is ever changing, these countries that you may be flying to, things could change in that place. Being in a airplane, you are in close contact with other individuals. At the moment, there aren't any recommendations to stop travel to other areas, but I would say that if you are going somewhere, just know that there is always the possibility that that country you may be in, something might spring up there, and there might be some changes issued by the CD to that particular country.
I know that there's a lot of travel talk about like people going to other countries and being mindful of that. Should we be mindful of things that we purchase online that come from those countries? Because I know that that could possibly be a concern. So like ordering things on Amazon or any other type of website where the manufacturer is in one of the countries listed on the website. Should that be something that we're also being mindful of?
I would say at this time, that doesn't seem to be, considered risky behavior. I would just say that we would ask people not to order like string masks and sanitizer and kind of, it's mostly masks online. There's all this talk about ordering masks on Amazon, and now they have designer masks and stuff, and it's, we want to save those supplies, gloves and all that for our hospitals and our healthcare workers and our first responders.
We've talked and heard about the transmission through droplets. Are the infectious organisms also transmissible through contact with like linens or surfaces that people may recline on?
So as far as shared services, it is possible that there could be some. So, we're making sure that, things are, well, at least in schools, we're making sure we're wiping down services. We're not sure how long something could last on a surface. In regards to linen, I don't think there's any evidence at the moment that we could firmly say how long, and yes, but if there is a positive case, you would certainly want to wash thoroughly any linen that person had with warm water and detergent.
I've heard a rumor that men are more susceptible to COVID-19 than, I guess, women. Is that true? Is there any truth to that?
This is, as you can see, the first column, male to females, 2.7 to 1. Yes, so men, in preliminary studies, this is just looking at population data, patients who have the infection, they've seen it more so in men than in women.
Hi, my name is Dr. Henry Yoon. I am I'm a family physician and the medical advisor for the city of Stamford. I also work with Stamford Health as well. Thank you so much for all the information. I think it was very, very helpful. I just wanted to make a couple of quick comments. First of all, just a reminder to really reinforce the idea that prevention is kind of going to be one of the biggest priorities, right? We're trying to prevent the spread. Are we going to be able to stop it with all the things that we're doing immediately? No, but we definitely want to slow the spread. And a lot of the things that Dr. Shaw and Ms. Konopko had talked about is going to be of paramount importance when it comes to prevention. The other thing we want to keep in mind is, again, speaking on behalf of the city, The City of Stamford, the leadership, the administration, the Department of Health are all looking out for the best interests of its citizens. Again, that is a priority. We want to make sure that we keep our citizens safe. We want to keep them healthy. And so we're taking these steps and these efforts to, again, get education out there, work collaboratively with our partners, particularly Stamford Health. Stamford Hospital is Stamford's hospital, so we want to make sure that we're all there and available for Stamford citizens as well, and the surrounding area, absolutely. The other thing I want to ask is really more of a favor from you more than anything else. A couple of things. As a family physician, as a primary care physician, I have to make the plug that it's really important to have a primary care provider. They are a tremendous resource for you. They know you. They know you better than any of the rest of us do. So really, please use them. Establish yourself with a primary care provider if you haven't already. They're going to know you the best. Several questions came up today specifically about immunosuppression and comorbid conditions. And again, we can speak generally on those topics, but your primary care provider is going to know you the best. So please, if you haven't already established one, please find one. Stamford Health is a great resource to help connect people together. So it's going to be really important to use them as a resource. Please use the health department as a resource. We have a webpage out there. We have a hotline out there available. So we want people to contact us. And as for the ask, the favor that I have is this is going to be a team effort, right? It's going to be just as important for experts in the area to provide information. We need you, again, to be out there, to be doing those things that we talked about in terms of prevention, and most importantly, we're also going to need your help to educate the public. There's going to be a lot of misinformation that's out there and myths that need to be dispelled, and it's unintentional. I'm not suggesting that people out there are trying to make things any worse than it really is, but again, that's why you're here. You're here asking questions to educate yourself, and we're going to need to rely on you to be part of our team. So I'd like to be able to think that everyone's going to be part of that team and look out for the best interests of the city of Stamford and their citizens. So thank you. And good evening.
Can I ask you a question? When I was